Okay, so a lot of people ask me, when should they involve members of the public or members of their local community in research? And the short answer is, it's never too early to involve people in your research projects. Similarly, if you've already got started on your research project and you haven't got any members of the public involved in your research, it's never too late. There's lots of different ways you can involve members of the public and communities in your research. And I'm sure you'll find that if you involve them meaningfully, they'll add real richness and value to your research projects. Firstly, the minute you have an idea of a research project, when you have that first germ of an idea, it's important to get people involved as soon as possible. Involving people in your local communities or members of the public that have experience of living with a particular condition or caring for someone with a particular condition, or if there'll be service users that will benefit from your research, it's important to engage with them and work with them to make sure that your research project is relevant to them and it will address their needs and priorities. So ensuring that your research is relevant is the first point of the research cycle where you can involve members of the public. A lot of research funding panels now involve members of the public in commissioning research. Commissioning is important because a lot of public funds are spent on research, on funding health and social care related research. So it's important that these funds are spent in the correct way. Thirdly, in designing and managing your research project. People with lived experience of a particular condition or people who care for people with a condition will help you design your research project to ensure that your research methods are ethical and that they are acceptable to members of the public. You want to encourage people to participate in your research, so therefore you have to ensure that what you're asking patients or people who will be participants isn't too burdensome. For example, you don't want to give them a 300-page questionnaire to complete, or maybe ask them questions that are too sensitive, or ask them to undergo any tests which isn't actually acceptable to members of the public. People involved in your research can also help you overcome logistical or practical barriers, such as ensuring that there's disabled parking close by to an interview, for example, or determining the length of a qualitative interview. In managing your research project, it's really important that on your governance, you have a public voice at every level. So, for example, on our research projects, we make sure that we have a public advisory group that meets with us to determine our public involvement strategy, but that they're also represented on any of our management committees or our steering committees or our executive committees. No decision is made about research projects without a public voice being present. Some research projects involve members of the public in undertaking research. This is really important because sometimes members of the public can provide a different perspective and also make other participants feel at ease. This works particularly well in qualitative interviewing, for example, if you're working with vulnerable communities. Similarly, we use members of the public in facilitating a focus group or co-facilitating a session. It can really help break down some barriers. It's important to add, however, that if you are working with members of the public who are going to be used in undertaking research, that they have the required training and support to enable them to do that role. Patients and the public can be really valuable in helping to analyse research findings. They can work alongside researchers and highlight parts of the research that are really important to them. Sometimes this isn't necessarily the same as the findings that are important to researchers or to clinicians. Patients and the public can have a really, really valuable role in helping you share and disseminate your research findings. Most researchers have in mind publication of a research paper in a peer-reviewed journal or presenting at international conferences. But your public contributors will really help you identify other ways you can share your research. This might be, for example, presenting to a local community group, sharing information with charities, and they might think of formats that are much more accessible to members of the public. Finally, implementation. Patients and the public can really add value in helping ensure that your research is translated into practice, and patients can be the missing link in helping to ensure that we move from what we know and the evidence that's been found in the research project to moving to what we do in practice. Patients can be a real catalyst in this area of research. And then finally, you go back to the end of the circle. When you finished your research project, you've disseminating your findings, patients can really help identify topics for future research and help make sure that the research that you continue to do is relevant to members of the public.